I work as an animal attendant at a veterinary clinic. A client came in having used rubber bands on their two dogs' scrotums as a method to neuter them. This is incredibly dangerous. The idea came from how sheep and goats are sometimes neutered, but there's a massive difference between the anatomy of a sheep and a chihuahua. Both dogs developed severe infections, and the tissue in the area had completely died. The cost of treatment ended up being far higher than standard neutering procedures. Never do this under any circumstances. I treated a patient last year who had been dealing with chronic, nonspecific abdominal pain. Despite undergoing numerous evaluations, including gastroscopy and colonoscopy, no cause for his symptoms had been found. He was convinced he had intestinal parasites, which he believed were contracted through an encounter with a woman he met online. After seeing multiple doctors and specialists without answers, he decided to take matters into his own hands. He bought surgical tools and anesthetics from the internet, studied videos on YouTube to learn how to perform a laparotomy, and attempted self-surgery using a camera for guidance. He managed to open his abdominal cavity, but couldn't finish and had to call an ambulance for assistance. I had a patient who decided to use honey as a remedy for cataracts and glaucoma. Unsurprisingly, he ended up with conjunctivitis because bacteria had colonized his corneas. Here's a story from an EMT friend. He and his partner responded to an eye injury involving a child who fell while running with a pencil. Before they arrived, the mother had already removed the pencil. While riding in the back, the paramedic advised her, "Next time, don't remove anything impaled. It's dangerous." Without hesitation, she calmly replied, "Oops, I didn't know that," and promptly pushed the pencil back into the injury. It was definitely an eventful night. Edit. Corrected a typo from autocorrect. I had a patient with severe psoriasis, with thick scales covering his legs. One day, he was admitted, and the scales were completely gone. He explained that he had scraped them off with a Brillo pad, steel wool. Surprisingly, it worked without causing complications, and he has remained scale-free for over a year. An elderly farmer came to the emergency department with a seriously infected head wound. He had noticed a growth on his head over several weeks, which turned out to be a tumor. His method of treatment? He had been applying Roundup, a powerful weed killer, reasoning that it kills everything. I was called to a home around 11:30 p.m. for a situation involving fingernail polish in a girl's eyes. The scene was chaotic, with people yelling and throwing things. We quickly spotted the mother holding down a young girl and preparing to pour something into her eyes. It turned out to be nail polish remover. The parents of a child canceled his ACL surgery after their church congregation prayed for him the Sunday before, believing he had been miraculously healed. However, they rescheduled the procedure later that same week. An 8-year-old boy tripped over the cord of a deep fryer, spilling hot grease onto his shoulder and arm. His grandmother decided to cover him in butter, believing it would cool him down and draw out the heat. When my partner and I arrived to check on the child, I felt a mix of sadness and hunger. The kid smelled amazing. Just to be clear, I'm not a cannibal. I work as a triage nurse and once got a call from a patient complaining of back pain. During my routine questioning, I asked if he'd taken anything for the discomfort. His response, Cobra Venom. He had read about Cobroxin, a pain relief product derived from cobra venom, and thought it would be better to have an actual cobra bite him. I have no clue where he even found one. I treated a patient who was using a sonic emitter to cure her lung cancer. Her reasoning was that since sound waves can break glass, they should easily destroy cancer in her lungs. During med school, a man came to the emergency room with a toothbrush and 2 combs stuck in his rectum. He'd inserted the toothbrush for pleasure, but couldn't retrieve it. He tried to fish it out with one comb, lost that, and repeated the process with a second comb, losing that as well. The twist? He wasn't even there to address the situation. He had been in a car accident and only shared the information after we asked if there was anything else we needed to know. A patient arrived at the ER complaining of intense pain and swelling down there. On examination, we found extreme swelling and redness, both inside and out. She was so inflamed that she couldn't urinate without a catheter. During a pelvic exam, the doctor found blisters on her cervix. When we asked when the symptoms started, she explained, "It was itching earlier tonight, so I thought I had a yeast infection. I poured a cup of bleach in there to kill it, but after a while, it started to hurt. Unsurprisingly, it did." Summary: never put bleach in your vagina. While working night shifts in a Midwestern ER, I encountered two men attempting to treat erectile dysfunction themselves. One used caulk in his urethra, but it dried, cracked, and only a small piece came out. The rest, broken into pieces, required surgery for removal. The second man used a cut piece of coat hanger to maintain an erection during intercourse, and that also had to be surgically extracted. Guys, just ask for Viagra. As an EMT student, I responded to a man who called 911 claiming a bug had crawled into his right ear. However, he kept complaining about a burning sensation in his left ear. His wife, standing nearby, was holding a bottle of insect spray. After some questions, we discovered she had sprayed the insecticide into his left ear, thinking it would flush the bug out of his right ear. I had to explain that ear canals don't connect. They're separated by the brain. A man came to the clinic with a golf ball-sized boil on his face. He explained that it started as a painful pimple, which he first tried to lance with a needle. When that failed, he escalated to using a micro drill, which he sanitized by wiping it on his jeans. The nurse interrupted him mid-story to ask, "So you drilled into your own face, and now you're wondering why it's swollen and painful?" I was the patient. A doctor I know shared a story. She heard it from another doctor about a man who came to the ER in a panic. After brushing his teeth for the first time in years, he noticed a maggot in his mouth. Over 3 days, this kept happening, so he self-diagnosed himself with oral myiasis. Terrified of insects, he attempted to get rid of them quickly by drinking Ipecac. This caused him to vomit massive amounts of maggots before he finally called for help. The doctor sympathized. Anyone would freak out after throwing up 50 maggots. It's horrifying. I work in 911 dispatch and heard this story secondhand. A young child had an extremely high fever and wouldn't stop crying. When the paramedics arrived, they found the mother squeezing a lemon and rubbing it all over the child's forehead. She claimed it was supposed to reduce the fever and was confused as to why the baby wouldn't calm down. Couldn't possibly have anything to do with the lemon juice she'd been squeezing into the child's eyes for the past 20 minutes. Not at all. I used to work in a hospital lab in a rural town. One day I received a stool sample from the ER that was essentially a golf ball-sized blood clot. The ER occasionally sends us the wrong specimens, like body fluids mislabeled as urine, so I called the patient's nurse to clarify. She explained that the patient believed he'd eaten spoiled pork, and in an effort to prevent food poisoning, drank a mix of bleach, rubbing alcohol, vodka, ibuprofen, and Tums. As a GP, one of the most absurd things I've encountered was a young man, likely between 20 and 22, from a very poor, uneducated family. He had severe tonsillitis, but refused to take any medication, insisting that all he needed to do was bite the sun. His method involved standing outside at noon, opening his mouth wide, and pretending to bite the sun repeatedly, believing this would burn away his tonsils and heal him over a few weeks. When this failed, his backup plan was to perform the same ritual under the light of a full moon at night. Summary: the cure for tonsillitis? Fight the sun. I worked at an OBGYN clinic for 7 years. One day, a woman called in saying she had a broken shot glass stuck in her vagina. When asked how it got there, she explained she had been using it as a form of birth control. Fortunately, it worked, because anyone that clueless shouldn't be reproducing. A patient came into the emergency department with an abscess. He claimed he knew he had an infection and decided to eat 1.5 pounds of raw steak, thinking it would contain the antibiotics the cow had received.